Hey guys, welcome back to Quick Nursing Shots with Smita, and today we're going to talk about cholelithiasis. So, the condition under your gallbladder disease, and let's see the definition. So, it is defined as a calculi or a gallstone, usually formed in the gallbladder from the solid constituent of the bile. They vary greatly in size, shape, and composition. It means that cholelithiasis is a stone formation in your gallbladder, just like your kidney stone formation in your kidney. The same way here, the stone forms in your gallbladder, and usually this is consist of cholesterol or any other constituent of the bile. So whenever there is hyper saturation of any other constituent of the bile, there will be a stone formation which is called as cholelithiasis. Now the etiology and the risk factors, it says that obese people are at the risk of getting this problem, then women with multiple pregnancy, frequent changes in weight like rapid weight loss, treatment with high and low dosage of estrogen, then ileal resection and some disease like cystic fibrosis, and people who are having diabetes mellitus are at the risk. Now the pathophysiology. So pathophysiology says that when cholesterol concentration exceeds the solubilizing capacity of the bile, it means when your bile is super saturated with the cholesterol, it means that the cholesterol level is that high that your bile cannot dilute it into. So that cholesterol supersaturation will cause nucleation to happen, because there will be a hypomotility, which means stasis, which means the stasis of cholesterol level in your bile will cause hypomotility, and that remnant will promote this nucleation process to happen. So nucleation happens when the when all the molecules of cholesterol gathers together and it form a stone which is called as cholelithiasis. So after this nucleation, there will be cholesterol monohydrate crystals, and these crystals, because of hypersecretion of the mucus, these crystals will get aggregate or stick to each other, and it will form a microstones, and later these microstone will again form will again build and aggregate other cholesterol due to this hypersecretion of the mucus, and will turn into a proper made gallstone or gallbladder stone. So these gallbladder stones are something which is insoluble, will not be diluted in your bodily fluid. So it will be as such in your gallbladder, and we have to perform some procedure to take it out, just as we do in your kidney stone. So this is all about the pathophysiology. So moving on to the clinical manifestation. So these gallstones may be silent. It means this having gallstone will not cause any symptom in the patient, and it will not even produce any pain. But the person can have some symptoms which go from mild to moderate, like pain and biliary colic. So it is the vague pain in your right upper quadrant of the abdomen where your gallbladder is situated, and this pain and biliary colic will happen due to the obstruction in your main bile duct. Then jaundice occurs because of same reason. There will be obstruction because of these stones in your gallbladder, and the bile duct will get obstructed, so there will be a stasis of your bilirubin, causing hyperbilirubinemia, causing jaundice to happen. Then changes in your urine and stool color, same reason, due to jaundice this will happen. Then vitamin deficiency occurs because of this obstruction. There will be malabsorption, or there will not be proper absorption of certain vitamin, so it will lead to vitamin deficiency, including your bleeding problem, because there will be deficiency of vitamin A, vitamin D, vitamin E, and also vitamin K. Then assessment and diagnostic findings says that we'll start with very history collection, take history of the patient, about his medical, about his diet, about his medical history, his surgical history, and family history. Then going on to the physical examination, perform the palpation, percussion, auscultation, and inspection, ask the person about his pain intensity and the type of pain he is feeling. Then abdominal x-ray is performed in this case, and ultrasonography is a choice of investigation we perform in this. Then radionuclide imaging, or we call it as cholecystography. Then also cholecystography is performed in case of cholecystitis, usually we do it. Then endoscopic retrograde cholangiopancreatography, so ERCP is also performed in this problem. And also ERCP is a very very important question for 5 marks. If not, then it could be asked for 2 marks, but it is a very important question both for practical and your written answer. Then percutaneous transhepatic cholangiography and serum alkaline phosphatase, GGT. So all these serum level, your LDH and cholesterol levels have to be monitored, because the pathophysiology, as you have seen, that this hypersecretion or the hyper supersaturation of the cholesterol will let us this situation to occur. So this is what we do in assessment and diagnostic criteria. So moving on to the management. So yes, this is it about the video. We will not be having discussing management today, so we'll look for the management part in our next video. So I hope you guys are studying well and you are relating with my content. So if you like it, just do it, give it a like, thumbs up, and share it with your friends and your classmates, and let them study also. And subscribe to my channel, guys, help me grow my channel. So thank you so much and study well. Bye bye.